Look at your fingernails right now. Pick one nail, press down on it firmly for about 2 seconds, and then let go. Watch how quickly the color returns. What you just did seems simple, almost too simple to matter. But that tiny test can reveal something important about circulation, oxygen delivery, and the health of the smallest blood vessels in your body. And after the age of 60, those small changes matter more than most people realize. Because your nails are not just there to protect your fingertips or help you open a package. They are one of the few places on the body where subtle internal changes can become visible long before people feel alarmed enough to seek help. And that is exactly why I want you to pay attention today. I'm Dr. Michael, and in this video I want to show you 4 specific nail signs that older adults should never ignore. These are not cosmetic details. These are not the kind of changes you should automatically dismiss as, "That's just aging." What we are discussing is the slow pointing toward problems with oxygen, circulation, nutrient deficiency, or systemic illness, the kinds of hidden issues that can eventually affect the brain, the nerves, balance, memory, energy, and overall health. And the 4th sign is the one I most want you to see before this video ends, because it is the one almost nobody is taught to recognize correctly. In fact, many people look right at it for years and assume it means absolutely nothing. Before we go any further, drop your age in the comments right now and tell me if you've noticed any change in your nails in the last 1 to 2 years. Slower growth, a color change, ridges, curving, anything at all. I read those comments and they helped me decide what to cover next. Now, to understand why these nail signs matter so much, especially after 60, you need to understand one simple thing about nail biology. Your nails grow from an area called the nail matrix. It sits just under the base of the nail, and it depends on a steady flow of nutrients, oxygen, and healthy blood supply. The tissue under the nail bed is packed with tiny blood vessels. Those tiny vessels often show stress before larger systems in the body create dramatic symptoms. That is one reason nail changes can matter. Another reason is that after 60, the body often becomes less forgiving of slow, silent problems. A person can have mild anemia, reduced oxygenation, vascular issues, nutrient deficiency, or the after effects of systemic illness developing quietly in the background. And because the change is gradual, it gets normalized. People say things like, "I'm just getting older," or "I've always had weak nails," or "That's probably nothing." Sometimes it is nothing, but sometimes the nails are showing you a clue your body has been trying to give you for months. So let's go through the 4 signs one by one. Stay with me all the way to number 4, because that is where one of the most commonly missed warning signs appears. Number 1 is pale or spoon-shaped nails. This is one of the easiest signs to overlook because it often develops gradually. You do not wake up one morning and feel as though your nails have suddenly transformed. Instead, they slowly begin to look less pink, less healthy, and in some cases they begin to curve inward in the center, almost like a tiny spoon. That spoon shape has a name. It is called koilonychia. And when it appears, especially along with unusual paleness, it can be a sign that the body is dealing with iron deficiency. Now here is why I care about that as Dr. Michael, and why you should care too if you are over 60. Iron deficiency is not just about feeling a little tired. When iron runs low, oxygen delivery throughout the body can suffer. People may begin to feel weaker, colder, more short of breath, less steady, less mentally sharp. Some develop headaches, some notice reduced exercise tolerance, some feel lightheaded when they stand up. And in older adults, low iron or other deficiency states can quietly chip away at stamina, concentration, and nerve comfort long before anyone connects the dots. There is another layer to this. Vitamin deficiencies, especially in older adults, can also affect the nervous system. That means tingling, burning, numb feet, unsteady walking, and changes in sensation are sometimes part of the bigger picture. So when the nails are changing along with energy, balance, or sensation, I pay very close attention. A lot of people dismiss this sign because brittle or pale nails sound cosmetic. But if the nail bed is losing healthy color, or the nail begins to flatten and cup, that is not something I want ignored for a year or two. Think about a woman in her early 70s who notices her nails have become pale and oddly soft. At first, she assumes she just needs a stronger nail product. Then she realizes she's also getting tired after climbing stairs she used to handle easily. A few months later, she starts feeling a strange crawling discomfort in her legs at night and assumes it is just part of getting older. When she finally brings all of it up during a routine visit, lab work shows a deficiency that had been building quietly for a long time. Once treated, the fatigue improves, the restless discomfort eases, and she realizes her nails had been hinting at the problem long before she understood it. That is how these signs work. They whisper first. The practical takeaway is this: look at your nails in natural daylight. If they appear unusually pale, thin, or spooned inward, especially if you also have fatigue, dizziness, shortness of breath, restless legs, or tingling in the feet, make a note of it and bring it up with your clinician. Ask whether simple blood work, including iron studies and other deficiency screening, would be appropriate. And if you have ever noticed your nails looking flatter or paler than they used to, type the word pale in the comments. I want to know how many people have seen that and never thought much about it. Number 2 is clubbing. This one matters because it often hides in plain sight. Clubbing is when the fingertips gradually enlarge and the nails begin to curve downward, more than normal around the tip of the finger. It usually does not happen overnight. It develops slowly, which is exactly why people miss it. They see their hands every day, so the progression can become invisible to them. The reason this sign deserves respect is that clubbing has been associated with chronic low oxygen levels and with serious underlying conditions involving the lungs, the heart, and other systemic disease processes. And from a neurologic perspective, anything that reduces oxygen delivery or reflects chronic cardiopulmonary stress matters. The brain is an oxygen-hungry organ. Nerves are not happy when the whole system is under strain. When a person has less oxygen reserve, less circulatory reserve, or a hidden condition affecting the heart or lungs, it can eventually show up in endurance, clarity, balance, and overall function. One of the easiest ways to think about clubbing is this. Your fingertips should not slowly become more bulb-like while the nail curves over them more dramatically year after year. That is not something I want dismissed as a harmless quirk. A common pattern is that a person notices they no longer cut their nails the same way they used to because the nail shape has changed. Maybe they say the fingertips look rounder or fuller. Maybe a family member sees it before they do. And often, because it is painless, it gets ignored. Imagine a retired man in his late 60s who starts noticing that his fingertips look wider and his nails feel more curved. He has also been getting winded a little faster during walks, but nothing extreme, no major pain, no dramatic collapse, so he keeps putting it off. When the change finally gets evaluated, it leads to testing that uncovers a cardiopulmonary issue that had been developing slowly in the background. In other words, the nails were not the disease, they were the clue. The practical takeaway here is simple. Compare your nails to older photos of your hands if you can. Look from the side. If your fingertips look enlarged and the nails appear increasingly curved downward around them, do not brush it off. Especially do not ignore it if you also have unexplained shortness of breath, reduced stamina, chronic cough, or unexplained fatigue. Bring it up. Write it down. Get it checked. Because the value of a sign like clubbing is not that it diagnoses anything by itself. The value is that it tells you the body may be asking for a closer look. Number 3 is the test I had you start with. Delayed capillary refill and persistently cool fingertips. This is one of my favorite at-home checks because it takes only a few seconds and costs absolutely nothing. Let's do it again. Hold your hand at about heart level. Press firmly on the nail for 2 seconds until the color blanches out. Then release and count. 1001, 1002. In many healthy situations, the pink color returns quickly. When it takes longer than expected over and over again, especially across multiple fingers, it can be a clue that circulation to the small vessels is not as brisk as it should be. Now let me be careful here, because I do not want you panicking over one borderline result. Cold hands can slow refill. Room temperature matters. Some medications can influence what you see. If you just came in from outside or your hands always run cold, that can affect the test. So the smart way to do this is in a warm room with warm hands on at least 3 different fingers. What makes this important after 60 is that circulation issues often develop gradually. People do not always feel a dramatic event coming. Instead, they notice subtler things: colder hands, slower refill, less tolerance for walking, more fatigue, maybe some lightheadedness, maybe more numbness or tingling in the extremities. The problem is that none of those symptoms alone feels urgent enough, but together they can start to paint a picture. And as Dr. Michael, I care about that picture because the brain and nerves depend on steady circulation. If the small vessels are sluggish at the fingertips, I do not assume that means catastrophe. But I also do not assume it means nothing. Picture a woman in her early 70s who tries the refill test after hearing about it from a friend. The color takes 3 to 4 seconds to return across several fingers. She repeats it the next day in a warm room and sees the same result. Then she thinks about the bigger pattern. Her hands have been unusually cold, she has been more tired, and lately she has felt less steady when moving quickly from sitting to standing. She brings it up instead of dismissing it. That conversation leads to a closer look at circulation, hydration, medications, and cardiovascular status. Nothing dramatic happened that day, but a quiet problem was less likely to stay hidden. That is what I want from a sign like this, not fear, but earlier attention. Here is the practical takeaway. Do the refill test more than once. Do it on multiple fingers. If it is consistently slow, especially if your hands are often cold and you have new fatigue, dizziness, leg discomfort when walking, numbness, or reduced stamina, write those findings down and bring them to your clinician. Specific observations are powerful. Saying, "I tested 3 fingers in a warm room and refill stayed slow," is much more useful than saying, "I think my circulation might be bad." And if you actually did the test while listening to this, tell me in the comments how long it took. 2 seconds? 3? Longer? I'm genuinely curious. Now we get to number 4. This is the sign I told you almost nobody understands correctly. Number 4 is horizontal grooves across the nail, also called Bowes lines. And the reason this sign earns the final position is that people constantly confuse harmless age-related changes with warning signs they should actually respect. Vertical ridges, the lines that run from the cuticle to the tip, are extremely common with aging. Most of the time, those are not the issue. Horizontal grooves are different. These are dents or depressions that run across the nail from one side to the other. They are not just texture, they represent a temporary interruption in nail growth. In plain English, the body hit some kind of physiological stress hard enough that the nail matrix slowed down. That stress could come from a serious illness, a major infection, uncontrolled metabolic strain, significant inflammation, malnutrition, or another systemic event the body had to fight through. What we are discussing is the slow. Now think about why that matters after 60. A severe body-wide stressor does not always leave a dramatic memory. Sometimes people recover from an illness, a period of instability, or a difficult stretch and move on without realizing how hard their system was hit. But the nails can preserve that history for months as they grow out. And when I see Bowes lines in an older adult, especially if they appear across multiple nails, I start thinking bigger. Was there a major illness? Was blood sugar poorly controlled? Was there a severe infection? Was nutrition impaired? Did the person go through a period where the body was under more strain than anyone realized? All of that matters to the nervous system, because when the whole body is stressed, the brain feels it, the nerves feel it. Recovery becomes slower, reserve becomes smaller. And if the underlying trigger is still active, poor metabolic health, inflammatory burden, inadequate nutrition, chronic illness, then the lines are not just a history lesson. They may be a clue that the problem is not fully over. Imagine a man in his late 70s who notices broad grooves forming across several fingernails. He assumes they are just old age lines, but when he thinks back, he realizes the timing matches a period a few months earlier when he lost weight, felt weak, and never quite bounced back after a significant illness. He finally mentions the grooves during a follow-up visit. That leads to a deeper review of nutrition, blood work, metabolic control, and overall recovery. The grooves were not random, they were a timestamp. That is why this sign matters so much. Not because it tells you exactly what happened, but because it tells you something happened strongly enough to interrupt normal growth. The practical takeaway is this: look closely across your nails, not up and down. If you see horizontal dents running from side to side, especially on several nails at once, do not assume they are ordinary aging. Think about what was happening in your health a few months before they appeared. Was there a major illness, major fatigue, weight loss, severe stress on the body, or worsening control of an existing condition? Bring that timeline with you when you talk to your clinician. That context can be surprisingly valuable. Now let me put all 4 signs together into a simple framework you can actually use. Today, take both hands into good natural light. First, look at the color of the nail beds. Are they pink and healthy looking or unusually pale? Second, look at the shape. Are the nails flat, spooned, or curving more than they used to? Third, do the capillary refill test on at least 3 fingers in a warm room. Fourth, inspect the surface of the nails. Are there horizontal grooves across them that might reflect a past period of major stress on the body? And while you are doing all of that, do one more thing that people almost never think to do. Take a clear photo of both hands. Why? Because gradual change is hard to remember. What feels normal today may look very different when compared with a photo 6 months from now. A simple image can help you track whether the shape, color, or surface is changing over time. If you notice one of these signs by itself, do not diagnose yourself. That is not the point of this video. But if you notice one sign plus symptoms, or 2 or more signs together, that is worth paying attention to. If pale nails are showing up with fatigue and dizziness, that matters. If curved nails are showing up with breathlessness or reduced stamina, that matters. If slow refill is showing up with cold hands, numbness, or reduced walking tolerance, that matters. If horizontal grooves are showing up after a period of unexplained decline, that matters. The goal is not fear. The goal is earlier recognition. Because one of the biggest mistakes people make after 60 is waiting for symptoms to become dramatic before they take them seriously. What we are discussing is the slow cue. The body often gives quieter warnings first. Not always, but often enough that they deserve respect. And your nails are one of the easiest places to look. They are visible every day, they require no equipment, they cost nothing to examine, and they may help you notice a pattern early enough to ask a better question, request the right test, or have a more informed conversation about what your body has been trying to tell you. That is what I want for you. Not anxiety, not self-diagnosis, not internet panic. Just awareness. If this was helpful, consider subscribing, because I make these videos to help you catch the kinds of changes most people are never taught to look for. And if you have a parent, spouse, sibling, or friend 60 who would benefit from this, share it with them today. Because someone you care about may look at their nails tonight,